Welcome to the Six Hats podcast, where I, Dr. Shami, a lifestyle and nutritional medicine family doctor, will talk about how women strive to find balance each day by juggling their six roles, being a woman, mother, daughter, partner, business owner, and professional. Hello, everyone. Welcome back to the Six Hats podcast. I'm really excited to have Dr. Simone Peters join us today. Now, Simone has a keen interest into the role of brain-gut therapies in patients with functional gastrointestinal disorders. Now, she's the only academic to examine the efficacy of gut-directed hypnotherapy as a treatment for irritable bowel syndrome in Australia, and her data have shown it to be superior efficacy to that of the low FODMAP diet, and that's something that's very familiar with many of my listeners as the first-line dietary therapy applied in routine practice. Now, Dr. Peters was the first gut-directed hypnotherapist to be employed in the public healthcare system in Australia and formed the gut-directed hypnotherapy program at the Alfred Hospital in Melbourne. She's also worked tirelessly to make gut-directed hypnotherapy available for wide-scale use through the development of the app called Nerva. And she's also the proud founder of the Mind Gut Clinic in Melbourne, Australia. So she sees adolescents and adults at the Mind Gut Clinic in St Kilda East and Armadale in Victoria. So welcome, Simone.
Thank you. Thank you so much. Thank you for having me.
So Simone, love to start with your story behind gut-directed hypnotherapy. Sort of what led you to actually study it and which led to your PhD? What made you so passionate about it?
Good question. So let's go back like a million years, it feels. When I was at school, the only subject I really enjoyed was psychology, to be honest with you. So when I went to university, I really wanted to study something in the psychology space. And so I did my undergraduate and honours years in psychology. And when I did my honours year, I very quickly learnt that I didn't love studying, but I really loved research. And so I made a little bit of a pivot. And instead of doing my Masters of Psychology, I decided to do a PhD. And I decided to do a PhD in the area of gastrointestinal disease because I have celiac disease. So this was something that was of great interest to me. And so I managed successfully to get a position with the gastroenterology department at Monash University, and we were based at Box Hill Hospital at the time. And actually the PhD was on a completely unrelated topic. It was looking at different psychological factors associated with an entity that we called non-celiac gluten sensitivity. So this was a group of people who thought that they had problems with the ingestion of gluten, but in fact did not have celiac disease. And somewhere along the line, my PhD did become hijacked somewhat by the utilisation of hypnotherapy in this patient population, so what we call these patients with disorders of gut-brain interaction. And it was through pure fluke that we started working in this space. There was a group in the UK that had started to do some research looking at using hypnotherapy specifically in patients who had irritable bowel syndrome. And you're always a little bit skeptical when all of the work comes out of one centre. So although they were brilliant researchers in their own regard, we thought that we might try and do a little bit of a pilot study of our own and see whether we could reproduce some of these findings. And the little pilot study turned into a massive RCT, and I think I did over 300 hours of hypnotherapy on this particular trial. And essentially we found that our outcomes mirrored that of the group in the UK in the context that there was a significant reduction in an overall and individual gut symptoms. So probably beyond what we had anticipated, and also significant reductions in people's psychological symptoms as well. So things like anxiety and depression and improvements in quality of life. And I guess that's when I became hooked on this as a therapy. And there's been lots of studies that have been done since then. But that was what initially sparked my interest in the utilisation of hypnotherapy, most definitely.
Amazing. But I'd love to take a few steps back. I'd love for you to explain what exactly is gut-directed hypnotherapy.
Well, hypnotherapy in general is really this idea of the communication with what we call the subconscious part of the mind. So we have two different parts of our mind, the conscious part of the mind, which we're communicating with now, and then what we call the subconscious part of the mind, which is the part that we communicate with through hypnosis. And so the idea is that in a session of hypnotherapy, or certainly in a clinical setting, we want to make direct suggestions to that subconscious part of the mind. And in gut-directed hypnotherapy, those suggestions are targeted toward the control and normalization of gut function. So gut-directed hypnotherapy is essentially a direct line of communication by the therapist to the patient while that patient is in a relaxed subconscious state. And then the idea is that we give lots of different suggestions and lots of different metaphors to help bring about change.
Amazing, amazing. And when you say that, and it's so interesting, I often hear a lot of skeptics going, does that actually really work? Like, does it actually affect the gut? Is it that simple? What would you say to that, Simone?
I think the simple answer is most definitely yes, obviously. I mean, there are things that go on at the mind level and there are things that go on at a gut level. And we know that things going on at either end do contribute to symptoms in patients who have irritable bowel syndrome. For example, at the gut level, we know that issues with motility can contribute to symptoms. We know that issues around what we call visceral hypersensitivity, so how sensitive the nerves are in the gut, and we know that this can contribute to symptoms in quite a large percentage of patients who have irritable bowel syndrome. We know the gut microbiome can also play a role. And so there's lots of different things that go on at the gut level. But equally, we know now that there is a really important link with what's going on at the mind level. And this can include things like issues with stress management, levels of anxiety and depression. And obviously, the aim of hypnotherapy is really to get the brain and the gut communicating with one another effectively. And of course, we know that this connection between the mind and the gut, like I said, is bidirectional. So that means that things that are going on in the mind affect the gut. Similarly, whatever is going on in the gut affects the mind. So yes, most definitely there is a link between the two. There was actually a really lovely study. It was published quite a while ago now. And essentially they randomized two groups of people. So there was one group of people who had irritable bowel syndrome with no psychological comorbidities. And there was another group who had psychological comorbidities. So they were either anxious or depressed or whatever it might be, but didn't have gut symptoms. And they followed these people for 12 years. And at the end of the study, they found that the people at baseline who had irritable bowel syndrome and no psychological comorbidities had either developed anxiety or depression. And the people who had psychological comorbidities but no gut symptoms had developed irritable bowel syndrome. So it works both ways. I think I will say that in terms of the hypnotherapy, the target, even though it's a psychological therapy, the target is improving physical symptoms, not psychological symptoms. And this is what makes it differ from other psychological therapies. So often in those patients who present with quite notable anxiety disorder or quite notable depressive disorder, as an example, in those patients, if we feel that the primary driver is their psychological state, we would use other psychological-based therapies. So something like cognitive behavioral therapy as an example. But in patients in whom we're targeting the physical symptoms, something like the gut-directed hypnotherapy is very suitable.
I'd love for you to sort of share, what does the program look like for our listeners? So when you do sign on to Nerva, and I believe it's a 6-week program, but obviously you've got access for a year because you might, they might need repetition. But what does that look like for someone?
So I guess the really important question there is around mode of delivery too, isn't it? And we know that obviously in research settings, when we do trials, originally they were all done face-to-face. So there was that face-to-face contact, and we knew that people responded really favourably to that. So we knew that about 80% of people responded, and we saw about a 75% reduction in symptoms. Now, obviously, access and cost can be prohibitive based on that model. And so we started looking at other ways of delivering the therapy that would make it A, more accessible, and B, more affordable. And that was when we started to become interested in this idea around digital therapeutics and the development of Nerva. So Nerva is essentially a gut-directed hypnotherapy program that is delivered over a 6-week time period. And the protocol in that program mirrors what we would do in research settings and mirrors what we have done in clinical settings. So essentially, it takes a patient through the program in a similar way to what you would expect in a face-to-face setting. So there's an assessment, then there is psychoeducation that is provided. So this gives people lots of different information about what irritable bowel syndrome is, how the mind plays a role, how the gut plays a role. And then there's obviously further explanations as to things that can go wrong at either end. Brings all of that information together. And then there's the deliverance of the gut-directed hypnotherapy as well. So in total, it probably takes people about 15 minutes a day to complete. And like I said, it's a 6-week program. So daily for 6 weeks, we ask them to try and commit to Nerva as much as possible. And we know the outcomes associated with this digital therapeutic are very similar to what we would see in face-to-face settings. So we can be really reassured that the app is doing what we want it to do in the patient population that we want to target.
Fantastic, fantastic. And I think you mentioned a bit about the research, but what does the evidence say about gut-directed hypnotherapy for IBS?
So it's very positive. So we know that, like I said before, we know that about 80% of people respond to gut-directed hypnotherapy, and we see about a reduction in 75% in terms of their symptom response. Now, this can include things like abdominal pain, issues around stool. So this can include consistency and form. So how often people are going and the form of their stools themselves. Issues with bloating, distension, we know improve following hypnotherapy, as does the reduction in wind. I think when you consider any medical condition, and irritable bowel syndrome is no exception, that there are often more than one management strategy or domain that is worth considering. And in terms of irritable bowel syndrome, we know that psychological-based therapies work really well, and obviously hypnotherapy is one of those. But most patients do tend to respond best to what we call sort of a multidisciplinary approach. So they utilize hypnotherapy as an example, but they might also sort of dabble in dietary-based therapy or other sort of drug-based or pharmaceutical therapies. And to be honest with you, patients tend to respond best to a little bit of a combination of all three. So really great rates of efficacy. If I had a drug that, had an 80% response rate, I'd be a very rich woman living on an island somewhere. You'd never see me again. Really great rates of efficacy, and also maintained in the long term. So this is another important consideration, and certainly a criticism we received early on in our research was this idea around placebo response, and whether really what we were doing was just developing a really amazing placebo. And we know that the placebo response in patients who have irritable bowel syndrome is really notable, probably anywhere between 40 and 50% of responses to any therapeutic would be based on a placebo response. But obviously a placebo response is not maintained in the long term. And so one of the other really key certainly important factors is to make sure that we've done long-term studies as well, so we can be sure that this is not just a placebo response. And the longest study that's been done has been done over a 5-year time period, which showed maintenance of effect. So we can also be, reassured that in that 80% of people who are going to respond, they should maintain that improvement in the long term. And they shouldn't actually need to continue to listen to the hypnotherapy on a daily basis in order to maintain that effect. So we know that when they get to the end of the therapy, 6 weeks in this example, they should have responded really beautifully. And if they have responded, then, like I said, they should maintain that effect in the long term without having to continue to listen to the hypnotherapy on a repetitive basis.
Amazing, amazing. And as psychologists, how important is it to deliver that information, that lifestyle changes are just as important? Because you mentioned about diet and, yes, hypnosis. And what I see in practice is that we've got to look at it holistically. It can't just be one treatment, especially for mind-gut connection. What are your thoughts around lifestyle?
I think the really important consideration here is around education. And I spend almost half an hour, I think, with each one of my patients just educating them on what irritable bowel syndrome is initially. And you're right, this includes an explanation around the role of different therapeutics in terms of managing symptoms. And I don't think that, one size fits all. I think the reality is there's lots of different causes for symptoms in individuals. And so what that means is that we need to draw on different treatment domains in order to get the best outcome. And like I said to you before, medications are really important in a subset of IBS patients. Diet is really important in a subset of IBS patients, and also psychological therapies are really important. And so I guess to answer your question, what we want to highlight is that hypnotherapy is very effective, but you're right, often when used in conjunction with other therapeutics, it can also be really beneficial. And if we think about dietary-based therapies, you mentioned before a low FODMAP diet, we know that about 75% of people respond really favourably to a low FODMAP diet. So this is a diet that is considered a first-line therapy in this patient population, and we use it really often. Other lifestyle or behavioural-based strategies are also really important. So making sure that people are drinking enough water, which seems really obvious, but sometimes is overlooked. Certainly in our constipation predominant patients, sometimes something as easy as making sure you're consuming enough water is enough. enhancing natural stimulants. So things like coffee can be really useful, again, in our constipated predominant patients, equally reducing coffee intake in those that have diarrhea predominant symptoms. Sleep is a really important consideration, and making sure that people are achieving and maintaining really good sleep hygiene habits. Exercise is another really important way of managing gut symptoms. Your bowels love it when you're active, and so we're always encouraging patients to be as active as possible. And then I think, just more generally speaking, applying really good healthy eating habits. We talk about using diet for the treatment of disease, and obviously a low FODMAP diet is aimed at treating irritable bowel syndrome, but also sometimes just some basic dietary guidelines can be useful as well. So making sure people are eating foods from all 5 food groups, and that they are consuming as much variety within those 5 food groups as possible, and also minimizing discretionary items where possible. But no, you're definitely right. It's a combination of lots of different things, lots of different strategies that help to manage symptoms, and certainly lifestyle factors do play a role.
Amazing. Amazing. Simone, thank you so much for your time today. But before I leave you, I know you're a busy mom, business owner, entrepreneur, and professional. So how do you do it? How do you balance all your roles?
It's a really good question. I often joke with my girlfriends that if I'm succeeding at home, I'm failing at work. And if I'm succeeding at work, I'm failing at home. Now, that's probably a little bit of an exaggeration, but I think sometimes it is hard to have it all, or to stay on top of everything. And I think sometimes we just need to be a little bit easier on ourselves, that you don't have to be hitting A+ in every role that you have. In saying that, there probably are some things that I've learned over the years that just make strategies, I suppose, that make life easier. Number one is prioritizing things. And that means things that are going on at home as well as things that are going on in the office. And sometimes that will mean that my hours for a week heavily skewed in one direction in terms of, being in the office or being at home. But having the flexibility to be able to do that, I guess, is one really important thing. Time management and planning, really key. So when I'm at work and I'm on. Similarly, when I'm at home, I'm not touching things that are going on at work. Delegating, I think I have almost mastered the ability to delegate and outsource. And again, that's in relation to things that are going on in the workplace, but also things that are going on at home. What else do I do? I think self-care is one of those things that, a term that's thrown around, but like anybody, I'm not very good without much sleep. And so prioritizing sleep is a big one for me. And I'm a bit of a runner. I like to run, and I do tend to find that on the days that I run, which are most days, I'm in a much better mental state than the days that I don't run. And so while being fit is lovely, I think what's more is that just the mental clarity that it gives me. And so for me, that's a really important part of my self-care routine. I think learning to say no has been another one for me, one that has been really challenging to be able to implement over the years. But I think probably in the last couple of years, I've become pretty good at being able to say no to things that aren't going to provide me or my family with some sort of notable benefit. And when you get to the stage when you don't have a lot of free time, I think that becomes a really important skill to have.
Amazing. I think that's a fantastic list.
Having good people around me, having great people around, people that
So true.
Hugely supportive. I've got an amazing network of friends and family and colleagues and peers. And like anybody, you can't do anything alone. And so surrounding myself with those people is another really important factor in my ability to juggle.
Amazing. Thank you so much for your time today, Simone. That was so informative and just so helpful for listeners. So thank you.
Oh, you're very welcome. I'm really pleased that I could come on and have a chat.
Remember that this is general advice only. Please see your healthcare professional for more information. So what's your take-home message today? Remember, it's all about progress and not perfection. And are you suffering from stress? Visit the Usawa Learning Hub on usawa.com.au for more resources on how to de-stress, re-energize, and reclaim your health. Enjoy the journey.